I am so excited for the conversation that everyone is about to listen to. It is a fairly new conversation to this field, alcohol and cancer, and the link between the two from the former Surgeon General's warning and recommendation to the country.
Two really big things in our society. Alcohol, we know, is throughout American life. And unfortunately, cancer is something that we talk about a lot. So putting these two together and having a conversation will be really interesting.
Let's hear it.
Welcome to Connections, the podcast from addiction professionals of North Carolina, where we discuss addiction through the lens of policy and practice.
We're your hosts,
Sara Howe
and Morgan Coiner, and we're here to help you see how it all connects. Today on the podcast, we are joined by Catherine Brunson. She is the president of strategic initiatives at the Prevention Alliance of Tennessee. Welcome, Catherine.
Thank you for having me. I'm thrilled to be here.
Yes, we are so excited for this conversation. But before we get started, can you tell us a little bit about how you got here and the organization that is helping us with this podcast today?
Absolutely. I'm thrilled to be here. Although I work in the state of Tennessee, we have a statewide association of coalitions. I'm here on behalf of the Opioid Response Network. The Opioid Response Network is funded by a grant through the Substance Abuse Mental Health Services Administration. It's administered through the American Academy of Addiction Psychiatry. They've been around now, I want to say, about 4 years. They provide training and technical assistance for free for any organizations, government, community organizations, anywhere from prevention, harm reduction to treatment and recovery, anywhere across the continuum. And again, all of it is for free. They have consultants around the country that have some expertise in different areas. And so I would really encourage anyone who needs assistance around substance use, particularly opioid misuse or stimulant misuse, to put in a request, even if you don't know exactly what you might want. They can have a consultant kind of help you define what it is that might be beneficial. So if anyone out there would like to put in a request, it's opioidresponsenetwork.org. And they get back with you within 24 hours to your request. So I'm really thrilled to be here. It's been interesting traveling with the Opioid Response Network and working with different communities.
Well, and those of you who may have attended our conferences, we are technically live from our North Carolina Prevention Conference right now. The Opioid Response Network has helped us bring a lot of really great speakers around a number of topics that many of you have enjoyed. So we are very appreciative of their support. At the end of the podcast in the show notes, we will have a link to a survey that's just a quick couple questions of evaluation. If you listen to this episode, we would love for you to fill that out. That helps ORN keep their funding. So we want to make sure that we can help them out the way that they help us out.
Absolutely. Thanks so much.
Yeah.
So you came to the conference to do a presentation on alcohol and cancer. And I think that's it's a critical topic. Recently, we saw the previous Surgeon General do a release on this particular topic, the intersection of alcohol and cancer. I'm a cancer survivor myself. So going on 15 years from breast cancer. I had breast cancer when I was 34. And this is really near and dear to my heart because as I started looking at my own recovery from breast cancer and figuring out what were the things that I could do that could keep me healthy, I had no idea the intersection, we're talking one cancer, not all of them. For me specifically, when I was looking at it, I had no idea the intersection of alcohol and breast cancer. Mm-hmm. And it makes my head explode every October because I'll go to a restaurant and they'll be like, it's the pink drink. We're going to offer the pink margarita or the what? And proceeds from that drink will go to. I'm like, whoa. We don't talk about this. That's, like I said, that's just one of many cancers. We don't talk about this intersection hardly at all. So you being here to talk about it and spread the word, it makes perfect sense, that intersection. but we don't have that conversation out of the general public.
Yeah, so when I was asked to come present on the Surgeon General's report that was just released this year on the link between alcohol and cancer, I'm going to go a little further than you. The report really outright says it's not so much as an intersection, or there is a causal effect, which means a cause and effect relationship. It's not even a correlation. And
That's a big difference.
There's a big difference.
Yes.
And self-disclosing, I put myself through college cooking. And so my relaxation when I have at the end of the workday is to come home, take a shower, put on some comfy clothes, pour that glass of wine, and start chopping and fixing dinner. That's just very relaxing. That was so once I got through the entire report, I have changed my routine because it was really eye-opening to me. And the biggest piece that really stood out is the recommendation in the United States is one standard drink is 14 grams or 0.6 fluid ounces of alcohol, which is the equivalent of 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of alcohol. The recommendation being that a woman should have no more than one drink, a man no more than two. And all the research that's in this report shows that the link between 7 different types of cancer and alcohol begins below those recommended minimum levels. And so that was just just hit me in the face because you don't think just having a glass of wine is that big a deal. But what they found is over 185,000 cases of cancer attributable to alcohol happened at less than 2 drinks a day. So the interesting part of the study was that although the standard drink is the 5 ounces of wine or 12 ounces of beer or 1.5 ounces of hard liquor, is that there was a very strong link between the development of cancer both in men and women occurring at less than 2 drinks daily. So I think the number one recommendation that comes out of this report, there are many, many recommendations, but the number one recommendation is that we need to revisit our dietary guidelines as far as what we recommend as a safe amount. I think we all have heard for most of our lives that moderate consumption is safe and can even have some health benefits. And this Surgeon General's report absolutely 100% calls that into question. And so the other big recommendation is that we need to change the warning labels that we have on our beverages. I look back at, it's been exactly 60 years, 1964, when the Surgeon General's report on alcohol and tobacco came out. Within 1 year of that report, there were warning labels put on tobacco products, and all advertising was ceased. I think we are in the same place literally 60 years later, and this is not the first evidence that we have linking alcohol to many different types of cancers. And so it's time that we kind of catch up with the times. Those warning labels have not changed since 1988. That's almost 40 years. And if you look at a bottle of wine or something and you look on the back in that little black writing, where it says a warning for pregnant women or about operating machinery, that's easily overlooked anyway. But the recommendation being is that warning label needs to be more aware, like making it stand out a little better, and most certainly needs to draw that very conclusive link that drinking alcohol at any level can increase your risk of contacting 7 different types of cancers. And the report goes on to say that the more you drink, the larger that increase, especially it's cumulative over time. So heavy drinking over a large period of time really is the number one risk factor, but there's no one that's really safe at any consumption level.
I have a quick question because I'm sitting between 2 prevention people, and I did not come into this field through prevention. Is there what is the efficacy of warning labels and making sure that we change those versus, because I know you said it might be overlooked. I know I come into this as a person in recovery from alcohol. I never read the back of a wine bottle, but I'm not the average consumer, right? What are we looking at when we change that warning label? How do we anticipate that might impact people's consumption?
When I look at this report, I looked exactly to the report on tobacco and cancer.
Yep.
And I think about the 60 years of, I can imagine back in 1964, 65, when people started hearing, what do you mean I'm not going to smoke on a plane? What do you mean I can't smoke in a restaurant? Like all these changes that have occurred over 60 years, they didn't happen overnight. And I'm sure at the very get-go, people were like, well, you'll never make that happen, right? I think we used the exact same plan book, the game plan book that was used for tobacco that has been very successful, yet there's still room to grow. In Tennessee, we still have a lot of our schools where staff can smoke on the school campus. So there's still room. There's still room to grow, but it happens by incremental things. It's not just the warning labels that are going to make a difference. It's not just the advertising. But another big point that came out of the report was, 91% of folks were aware that radiation caused cancer. 89% were aware that tobacco caused cancer. It was like 81% were aware asbestos caused cancer. And yet only 45% of folks were aware that alcohol caused cancer. So we've got to start with raising that awareness before we can get into all these other policy changes that need to happen. But right now where we are, including someone in prevention for 25 years, this was a smack in my face. I was like, why am I just now hearing about this? I would have changed my behavior a long time ago, and I think it's incumbent on us, especially as prevention professionals, to at least provide that information so people can make a choice for themselves about what's the best thing for them. I just think it'll take a series of changes that we're going to have to implement, but it all starts with first raising that awareness and education that it's an issue.
One of the strategies in prevention is environmental prevention strategies. And I think, Catherine, you've talked about this, is I don't know just changing, warning labels is the only thing. So is there a study on just warning labels? I don't know. I don't know that I can quote that. But what I do know is we talk about environmental prevention strategies. We talk about changing that entire environment. So what we also know, by the way, in the last 20 plus years or so, we have changed our alcohol advertising restrictions and lessened them. You couldn't at one point advertise hard liquor on television at all. And
but you can now.
Now you can. Now we already know, this is one of my soapboxes, right? The amount of money that the alcohol industry spends on advertising. We get less money nationally for that prevention set aside than all the money that pick any one of the alcohol companies that you want to name. They spend exponentially more than we have in our entire budget nationally to do prevention work. And the lobby continues to push for lesser alcohol taxes, less restrictions on alcohol. Our alcohol taxes are like 1930s levels when we look at it. So that's an environmental piece. So you've got to fix those warning levels. We have to look at how we do our advertising restrictions. How close are we in proximity to schools and kids? Because I'm sure, Catherine, you've said it too. They have to keep replacing their customers, right? And that's a concern. And how do you do that? You start them young.
There's a whole range of individual and environmental strategies that can be put in place. And so yesterday in the session that I was doing, I said, look back to many, many public health education campaigns that we've done. You can, the Surgeon General's report is nothing merely but a recommendation. And so if none of us do anything with it, that's what it becomes, is a recommendation. So it's on all of us in this field, or individuals that care, that may be touched by cancer, maybe they're not in the substance use field, to do advocacy at both our local, state, and federal levels to make sure that some of those changes are brought into place. But as I suggested yesterday, I think almost every effort that really takes fruit starts with a voluntary effort. So I was talking to them yesterday about, we can change the restrictions around on-premise and off-premise. How many signs can you have? Can you remove the beer in the convenience store from being right next to the Yahoo and the chocolate milk? I remember in the early days, is back in 2000s, where we were all launching on these underage drinking campaigns. And what we knew was that the majority of kids were getting their alcohol from their parents. It wasn't from the convenience store. So one of the things that we did was employ our youth with a sticker campaign. And they went into convenience stores and they had a sticker that said, underage drinking is a mom and pop operation. And they placed them on the 6-packs. And I said, why can't we employ our young people to do this same thing, to start with a sticker campaign, to just raise awareness about alcohol causes cancer, and putting those as a voluntary place to start raising that awareness. I think a lot of voluntary efforts, really lead the way to people being more agreeable to, okay, well, let's have that conversation.
Yeah.
And I've always said it's kind of like a sailboat. Once you get a couple little successes in there, it starts billowing, and then that sail starts moving a lot quicker. And so I always advocate for people to start local and start with some voluntary things. Maybe it's a town hall meeting about the discussion with a panel from your emergency department or your a cancer specialist, and you're having people have that conversation.
I am like a product of the tobacco settlement dollars. I grew up sort of when all of that, I was born in 92. So kid in the 90s, early 2000s, like I remember the TV commercials about don't smoke, smoking is unsafe, all the truth campaign, like all these things. That is what I grew up with. And I remember all my parents smoked, my dad, my mom, and my stepmom. And like, those ads turned us into these little pests. And I remember my oldest sister put like little sparks in my dad's cigarettes once, so when he lit them, it would spark out. Like, we would flush them down the toilet. We were always like, you shouldn't smoke. It's disgusting. You're going to kill me with your secondhand smoke. Like, they turned us into these little like beings. But all three of my parents quit smoking, right? Like, there was something about I've never smoked a cigarette in my life, and part of it is because I can still recite some of those commercials, and those commercials made it safe for me to be like, actually, that's gross. Like, no offense to anyone who smokes, but this is, how I grew up, right? Like, I'm okay saying, like, I think it's gross, right? Like, I don't like how it smells,
That
right?
was the goal.
Right, and it worked. And I'm like, okay, how do we do that so that the message when, someone else is running this organization, and because this podcast has such a legacy, they're still doing this podcast. Who is the next person sitting in this chair being like, alcohol's gross? Like, it's going to cause cancer. It's going to, like,
I think
there's an opportunity.
I think you've nailed it. Yeah. I think it's our young people and engaging them in that message. I remember at elementary school, which was a long time ago for my kids, but they were going through that green phase, right? And so I remember my kids shaming me at the grocery store for the amount of paper napkins.
I did that too.
That we were using, and it was like, because it came from the kids, and this is what they learned at school, and this is what they were passionate about. I was like, okay, I'm buying the ones I'm going to wash. And so I think we can, educating our kids at a young level, literally in grade school, I think we can start this same thing. I, since I'm years past now, will admit to being a former smoker, a very much closet smoker.
Yeah.
And I didn't quit for my kids, I'll tell you that. But I never smoked in the house or anything.
Yeah.
But it was my granddaughters that got me to quit. And all they had to do was say one or two things, and I was just like, I'm done.
Right.
And I just quit like that, cold turkey, never looked back.
Yeah.
And I'll tell you, still have cravings. It's tough. It's tougher than people
know. Absolutely.
But our young people really do touch our hearts and can speak to us. And it was because of their concern that I was like, you're right. In the trash we go. Mimi's not doing that anymore. And so I think we really can employ those young voices. I also, I was just at the RX Summit, and there was this beautiful person from California that had won an international campaigns for his messaging to young people. And so one of the key pieces of evidence that came out of it was there's a difference between advertising and branding. And so advertising is trying to sway people to do what we want them to do. And so what the evidence showed is that if we will just provide honest, language with our young people. They want to know, and then they will make their own choices. And so I think we do need to get down and start into our younger levels. I was a little disappointed in Tennessee. It passed our House, but did not pass the Senate to require substance use and violence curriculum in all K through 12 schools.
Oh, that would be amazing.
I'm also from Ohio, and it did just pass in Ohio. So that's going to be something that's coming. And I hope that's a wave that we're going to see kind of coming across the country. I know from working with coalitions for over 25 years, it's surprising to many people. Schools are sometimes our hardest partner.
Oh, yeah.
And that's an experience that coalitions have nationwide. And so having that coming from the state legislature, that this is going to be a requirement, then that helps form and bond that partnership of how we can work together to fill that void. But I think that's something that we can also start trying to get on a voluntary basis in our school if we have good partnerships with our school system, is how can we provide a curriculum? Can we get your wellness teacher trained? Can we provide that ourselves? Like, how can we work to incorporate this more into our school curriculum?
Well, and I think with schools too, I was a teacher for a few years, and the people with the most power in the schools are the parents.
Mm-hmm.
And typically no one cares more about the child than the parent, right? Like there's this thing here where it's like we really also, I think, need to rally around parents and build them up to be the advocates, to be that liaison between us and the schools. Because if a ton of parents come in and say, this is what I want my school to do, the principal doesn't have a big choice there. They have to do something.
I was just going to say, I wanted to talk a little bit back to the cancer conversation.
Yeah.
The incidence of cancer in this country is going up. Right? One of our leading causes of death, if I'm not mistaken.
It's the third leading preventable being the key word. Mm-hmm. And so interestingly, the data from the report showed that in 2020, 72% of our adults, and they considered 18 and older, which we know 18 is not the drinking age, but drank at least one drink in the past week. And so that number, if you're familiar, was 2020 COVID year. Prior to 2020 COVID year, that number stuck around 56%. And so what they have found is that major increase that occurred during COVID, but unfortunately, it's not dropped back down. Mm-hmm. And so I look at all the changes that went into place, at least in Tennessee. We didn't used to have wine in our grocery stores. We do now. You didn't used to be able to buy it on a Sunday. You can now. We allowed it to be delivered to your door during COVID. You still can. And so all these changes have kept and are growing.
We went the opposite from our prevention.
And so that dramatic increase in the amount of alcohol consumption that we're seeing, and particularly it's among women. Yes. Women has been one of the larger groups that has that consumption, and we know that 60% of the deaths for cancer for women are to breast cancer. And so, when you talk about that pink margarita for breast cancer awareness.
Every October, my husband hates going to restaurants with me because I start ranting and raving. It's like, I just wanted dinner. I'm like,
now you get a so ass too.
I was on a plane, and they were selling them as a fundraiser on the plane too, the pink lemonade and the pink margaritas. And, I just think it's a conversation to have. And I think, I said this yesterday, I think this is one of the most beautiful places that prevention and recovery and join together.
Yeah,
great point.
Because we talked about bikes and brews, which a lot of us have. So why can't the recovery community go to the group that's doing bikes and brews and say, okay, but for the recovery community, can we have an alternative to the brews after the bike ride?
Right.
And I think, we talked about yesterday, the DEA Take Back Day, which is coming up, this Saturday. In the really early days, I was like, we're not going to be able to sell this. I don't think anyone's going to care. But I live in Knoxville at the base of the Smoky Mountains. We're very environmentally conscious about our waterways and our streams. And so we partnered with an environmental organization, Keep Knoxville Beautiful, to pitch it really as an environmental issue about keeping it out of the water streams. But if you bring back your mercury thermometers, we'll give you a digital thermometer to replace it. So I also think this is a lifestyle thing where we want to encourage more mocktails, more alternative activities. And so if there are things like Bikes and Brews going on in your community, I think the recovery community is the perfect place to go meet with them and say, let's have these healthy alternatives. And can we build in a component for individuals, not just in recovery, but folks that choose not to drink? I think starting campaigns really on focusing on that healthy element might be a better sell than just focusing on that link between alcohol and cancer. That let's change our social norms and make healthier choices. Try to change our community norms about what's acceptable. Do we have to have a glass of wine every night while we're chopping up vegetables?
Yeah.
No, we don't.
Well, yeah, so it's funny you say all this because when you reach out to ORN, you tell them, here's what I want someone to talk about. They find you someone, and then you have a meeting. And the first time I met you, Catherine, I was like, I know she's one of my people. And one of the things we love talking about on this podcast is that prevention and recovery are not at odds with each other. Oh, no. And so I'm like, you really are my people.
They're much more connected. And that's actually what I was going to say. I mean, I don't want to close on a downer. There are, from the prevention side and the recovery side, we do go into restaurants. Mocktails have become a thing. Now they're trying to get crafty with what they look like. There is a movement, I think, out there for people to support individuals in recovery or individuals that just say, I want to be healthier. I'm not interested in drinking.
Well, and you and I think, provide a great example. I'm in recovery. You're not. We will go to a restaurant somewhere to eat, and there's mocktails, and we'll both order a mocktail.
Right.
And it's like, it's not necessarily out of some solidarity with Morgan. Like, I don't want to get wine and hurt her feelings. It's really just like, it's available. So it's a choice, right? Like,
let's do that.
If it's not available, you might order a glass of wine. You might order something else, but the option matters. If it's because people do make good choices for themselves.
And so yesterday, a lot of people were talking about Bikes and Brews and those kind of things. And I said, okay, we're not going to get them to stop doing that right away, but we can build onto each one of those with a healthy alternative component. Yes. And that's where I think the recovery community can really help forge that relationship and sell that. But I do see changes. We have a recovery bar with live music in Knoxville where it's only mocktails. And during dry January, we had several bars across our community that all had mocktail menus and I think a lot of them have kept those. I was at a chili cook-off for mocktails not too long ago, judging. Fun. And so they used it as a fundraiser who could make the best mocktails. And it was actually bars and bartenders that got involved in that. And so I think we can just start shifting that idea of what's normal and healthy. And so I think, the first place I would start if I were in a community is raising awareness, is kind of reaching out and ticking on that healthy part. More than just trying to ram down someone's throat that alcohol, like they're already up in arms when you mention the alcohol. The link to cancer is to sway it in by talking about what are some healthy alternatives. And I do know from where our youth are right now that will totally resonate with them because they do care. They really do care. I think there's a lot of things that can be done, but it has to start with raising the awareness that it's even a problem first. And so one of the great things with that report, there were a lot of great graphics that were in my presentation yesterday. All of them are available online where you can just download them for yourself, add your logo to them, start using those as infographics to start sharing on social media, post in different places and share across the community.
Are you comfortable if we share those slides with our listeners?
Oh, absolutely.
Awesome.
Okay. Absolutely.
We'll get a link up.
All of them. I downloaded them off the web myself. And so there's some wonderful, wonderful graphics. I'm a big believer no one's going to read a report about anything, but a nice infographic, just kind of the picture captures with a key pieces of few information is a great way to start sharing and raising that awareness. And I always say to my coalitions when we work, we want multiple strategies across multiple sectors. Whatever it is you're trying to share, take it to whoever's around your table. And this is what we're going to share this month. Where can you share it? Oh, I can take it to the church. I can take it to my community, whatever it is. I can post this in the Boys and Girls Club. If we each start sharing those same messages across the community, we can really have an impact to start raising that awareness and then start having those conversations take place in our communities.
Yeah. But before we wrap up, I want to say thank you. You are not an alcohol and cancer expert. We reached out to you. You said, I'll read this report and I will do this. I will be the person who learns about this for you and I will come present on it and we'll have this conversation. And I appreciate you being willing to dig into that. We had a lot of trouble finding someone who felt comfortable talking about this. And I love that you just were like, okay, like I can read a report. I can make some, informed information off of this.
The fact that we had trouble finding says exactly why we need to have this conversation.
Yeah. So I really appreciate the effort that you put in for us to be able to have this conversation.
And I think if people will look into it, they'll get that same passion too. So this morning at 6:30 when I woke up, I was putting our newsletter together for the state of Tennessee. And guess what's happening on May 15th? Webinar on the Surgeon General's report on alcohol and cancer. I was like, we need to get this out to our community.
Absolutely.
So I will be broadcasting and pressing and sharing those graphics and encouraging our coalitions and folks throughout the state of Tennessee to start broadcasting and pressing this month. And so we're even going to do some little stipends to some communities, start having some town hall meetings, with a panel there to present that information and start raising that awareness in our communities. I think this is critically important. I know people don't change their behavior easily. I'm a person that had a glass of wine almost every night. I haven't had one since I started working on the report. It really hit me that strongly, especially when you have predispositions in your family to cancer already. I do think people will make different choices based upon the information, but I think it's our duty to make sure that they at least are aware of the risk.
Well, thank you. We're fantastic conversation, but thank you for taking the time and for sounding the alarm and calling the rest of us to make sure we do the same. So we're glad to have you here.
Thank you for letting me be here with you.
You're welcome. What a great conversation today with Catherine. I know we say that a lot when we finish because, well, frankly, we have great guests, but this is everything and more that I was hoping to talk about because that link, I mean, Catherine said it right up front. It's not just a correlation. We're talking about causation. Alcohol causes cancer. Let's not mix that up. We need to hear that and we need to talk about it more.
Well, and let's say it frankly, right? Let's not hide it in these scientific words. There are things that cause cancer. We know that alcohol is one of them. So let's figure out how to prevent it. And I think Catherine has fired us all up about ways that we can start to do that in our community.
The challenge for you all now is to take that message and get it out there.